It's Health O'Clock, and today's news story pick is really going to be very fascinating, I'm sure, for a lot of you. Ozempic is now in India. Ozempic, the global blockbuster and one of the biggest names of drugs, forget just weight loss drugs, has officially now got the green light to enter the Indian market. India's drug regulator, Cdsco, has approved it, but not for weight loss. That's a headline, remember. Instead, the approval is for type 2 diabetes and also for reducing the risk of serious heart problems and even kidney damage. Now, that's a first for India. Also, remember, India already has similar drugs with the same molecule available in the market. There is Wegovy, mainly for weight loss, and there is Mounjaro, which treats both diabetes and obesity. Now, interestingly, Wegovy and Ozempic come from the same pharma company, Novo Nordisk. So, what's the difference? Why two drugs with the same molecule? Well, both contain semaglutide, right? And the same active ingredient that helps lower the blood sugar, and as a side effect of it, it also brings down your weight. But Wegovy uses a higher dose. That's a simplified way of saying that it's been approved in higher dosages here in India and approved for weight loss. Ozempic, on the other hand, is a lower dose, means approved for lower doses, targeted at type 2 diabetes. Now, with this approval, Novo Nordisk now has two injectable semaglutide drugs in India, plus their oral semaglutide pill as well, that's already available in India since January of 2022. The launch of this, remember, this is just an approval, that means it's not out in the market just yet. The launch will happen soon. But with this, we have another drug now, another treatment option available for millions of Indians managing diabetes and its long-term complications. But how are you and I to sort of see this news? We've now done multiple stories on GLP-1 drugs and what they do. But let's try and take this Ozempic story forward with Dr. Rajesh Rajput joining us. He's the Director for Endocrinology and Diabetes at the Medanta, Gurgaon. Dr. Rajput, thank you so much for your time. The confusion about so many drugs which have practically the same molecule, practically the same composition, sometimes from the same pharma company as well, but come under different names and is for different use. Can you simplify this for our audiences, please?
Right. So thank you very much for inviting me. Now, to understand and simplify this confusion which you are asking, we have to just go back into the history. Now, see, semaglutide as a molecule initially was researched in a clinical trial program, which is known as SUSTAIN program. Now, based on SUSTAIN program, where the dosage of semaglutide used is 0.25 milligram, 0.5 milligram, and 1 milligram, the drug got approval from US FDA for treatment of type 2 diabetes, irrespective of your BMI. See, here BMI is not here, irrespective of your BMI in 2017. So it is 2017 when Ozempic got approval for type 2 diabetes by US FDA.
Got it.
But then as the drug was researched, it was found that it also results, the usage also results in large number of weight loss, good degree of weight loss. So the research continues, and for weight loss, there is a clinical trial program, which is known as STEP clinical trial program. I was part of STEP clinical trial program from India. And based on STEP 1 clinical trial program, in 2021, in a dose of 1.7 and 2.4 milligram, the drug got approval from US FDA for management of obesity. That is those people who are having BMI more than 30 or more than 27 with one or the other comorbidities like hypertension, dyslipidemia, and diabetes. So frankly, two clinical trial programs were done at different parts in the history. The drug for diabetes was launched in 2017. Drug for obesity was launched in 2021 by US FDA approvals. And then to avoid this confusion and to keep the things simplified, because the indications for use is different.
Yeah.
So in US, the regulatory,
Dr. Rajput, you're basically saying, you're basically saying that Hyundai and Toyota, the engine is the same, it's just under two different brands.
Maruti and
Similarly,
Toyota, not Hyundai, Maruti and Toyota.
Maruti and Toyota, thank you so much for correcting me and my auto knowledge over there. So Maruti and Toyota have both the same engine but come under different brand names. It's basically that. So people
Uh,
now have to, I think another news point out of this, which has perhaps been missed out in other reports, has been that this is perhaps for the first time the drug controller has mentioned heart and kidney issues as to be used for a GLP-1 drug. That's happened for the first time.
no, already the drug has approval from US FDA. Again, it is based on Sustain 6 program and Flow trial clinical program. Now, in these two important trials, patient of type 2 diabetes who have established cardiovascular disease, or in Flow trial, patients of type 2 diabetes with established chronic kidney disease were studied. And when semaglutide Ozempic in a dose of 0.25, zero point 0.5, 0.5 and 1 milligram is used, the results are very promising. In SUSTAIN program, the 3-point MACE, MACE stands for Major Adverse Cardiovascular Event, it is
Yeah.
reduced by around 26%. And the NNT, that is number needed to treat, is only 45, which means you need to treat 45 patients for 2 years to prevent one MACE event. Similarly, in flow trial, the it is benefit is by 24%, which means
Got it.
if patients who were given Ozempic, they have reduced risk of progression to ESRD, that is end stage renal disease, or requirement for dialysis, or reduction of eGFR by more than
Yeah.
50%, or CV
Got it.
death. So these are
Yeah.
very hard endpoints. So
Yeah,
the
right.
drug has got benefit, and that's why the regulators have given approval.
Got. Dr. Rajput, last question then. If somebody who's looking at treating diabetes with GLP-1, how much
Yes.
does the brand really matter? How much should they be thinking, should I go for Ozempic, should I go for Wegovy, should I go for, Mounjaro?
See, as a doctor, it is our duty to choose a brand is not important. For us, what is important is a drug, the molecule. Now we are going to choose a molecule based on evidence which has been generated with that molecule. So say, for example, I will simplify this. I will see a patient of type 2 diabetes who has already suffered myocardial infarction, which means heart attack. Now patient is also having diabetes. Now I have to choose a drug. Then based on that data, I am going to choose Ozempic based on data. Similarly, based on flow clinical trial, if patient is having an eGFR of less than 60, presence of micro or macroalbuminuria, type 2 diabetes, and patient is already receiving standard of care for management of CKD and diabetes, then probably it's time we should also add Ozempic in those patients
Got it.
because of the hard endpoints, benefits, which has been shown with Ozempic in these trials. So it is duty of the doctor actually to find out who is the right patient for which molecule, and even within the same molecule, which name or which brand.
That's right. And I think the key takeaway for anybody watching is that please don't self-prescribe. Please go to an endocrinologist if you're curious about this and you
Absolutely.
want to understand more. Please do not ask your dermats for aesthetically wanting to take GLP-1. Please don't ask your dentist. Please don't ask anybody else. They don't know. Ask your endocrinologist. That's very important. We leave it there for the moment. Thank you so much, Dr. Shukla, for joining us.
Thank you. Thank you. Bye.
All right, moving on to some more health news. Worrying one coming in this time. Mysterious death of 14 children in just 30 days. This isn't making headlines yet, but it should. In the past 1 month, 14 children under the age of 15 have died after being admitted to hospitals in Nagpur, Maharashtra, and in Chhindwara, Madhya Pradesh. The cause? Still unclear. The doctors are calling it Acute Encephalitis Syndrome, AES, a diagnosis often used when the brain suddenly becomes inflamed or stops functioning without any confirmed trigger. Now, here's what we know about this so far. Now, these children arrived with high fever and quickly deteriorated, some within 24 hours. Most went into acute renal failure, producing no urine. Several required dialysis and ventilator support. 6 of the deaths were from paralysis and from paresthesia block in Chhindwara, which is now being treated as a high alert zone. And all the children between 3 and 10 years old were the ones who were found to be infected by it. CSF and blood tests have ruled out any known bacterial or any viral infection as well. And as of now, the NIV, that's National Institute of Virology in Pune, and the NCDC, that's the National Center for Disease Control, have sent teams to that hotspot area to investigate and see what exactly is going on. Surveillance is being stepped up in rural Vidarbha and nearby districts as well. Admitted to also at Nagpur's hospital in similar condition. Doctors have begun classifying some of the newer cases as acute sort of encephalopathy, and rather than classical encephalitis in this case, and subtle but more important difference that affects how these children are treated. But here's what we don't know. No exact cause has been identified, no known pathogen, no toxin known, or any environment trigger that has been confirmed. Whether this is a new infection agent or poisoning or some environmental environmental cause, that's also under investigation. Why this is happening now, why it's affecting, otherwise healthy young children, we don't know. Whether there are any milder or undetected cases in the community, we don't know. Whether this is contained or if this could spread to other districts or states, we don't know. So a lot of unanswered questions, and people are losing kids, young kids are dying. Like I said, 14 kids in just 30 days. That's a worrying number. Let's cut across to Dr. Nihar Parikh now joining us. He's a pediatrician and director for Cheers Childcare. Dr. Parikh, very worrying news. Encephalitis, I thought that was largely a UP problem. I've reported from Gorakhpur for years to understand how it goes. It's a terrible disease. It generally spread across UP and Bihar, but in this area we hadn't heard of this. What is your basic understanding of what's going on?
So the understanding is still, we know what is causing we know the symptoms of the disease, but we don't know what is causing the disease. We don't know whether it's a viral, we don't know if it's a bacterial, we don't know if it's infectious or non-infectious. Non-infectious comes into the category of an autoimmune phenomena where a child's body recovers from an infection, but the body fights an infection much more aggressively than it should, and then technically starts hammering different blood vessels of the different parts of the body, causing multi-organ involvement, starting with the brain, kidneys, and everything. So, because what I read also and found out also that the tests that they did, the blood cultures, draining the fluid off the spine, checking for infections, has come clear for bacterial and viral. So still we don't have evidence whether it's an infective pathology or a non-infective pathology, which goes in the favor of an autoimmune. But what is important, and a takeaway message for all parents is that the minute the child has fever, if there are rashes followed by fever, if there is lethargy, giddiness, drowsiness, persistent vomiting where the child is not able to retain, they should not sit at home. And keeping in mind this AES like picture, they should show their pediatrician immediately, because the most important thing is the diagnosis of AES in time and getting the right medication to reduce the pressure in the brain.
Yes. Dr. Parikh, because this disease is now localized, it's happening in similar areas spread across the border, doesn't that tell us about the kind of infection it could be?
So again, it goes in two favors, because this can be a viral or bacterial, and we have not pinpointed. Plus, National Institute of Virology is already on it. So soon we should find the cause, which is extremely important. But it's otherwise next to impossible to find out whether it is a post-infection phenomena, like a random infection causing this as a complication, or the actual infection causing it. But isolating it, finding the cause of it, pinning it down to a bacterial or viral is of the key and the most important next step, which the people have reached there. The team, the task force is there, and we should have an answer in the next 24 to 48 hours.
And we'll keep a tap on those answers as well. Just because the story is not happening in Delhi and Mumbai doesn't mean we shouldn't be worried about it. We should care about every child. Encephalitis largely is not a rich man's problem, largely said, but we should still keep an eye for it. Thank you, Dr. Parikh, for joining us with all those details.
No problem.